Okay, folks, we're going to start our second panel on the sober living home crisis. And so we have 4 panelists this time, and we're going to have each of them introduce themselves and also talk a little bit about their role within this sober living crisis. So we'll start from my left, right? My left and going that way. Please introduce yourself and answer the question.
Hello, everyone. My name is Christine Holden. I am the Tribal Liaison for Access. I'm an enrolled member of the White Mountain Apache Tribe. I'm also half Hopi. As it pertains to the sober living home, I am currently the only Tribal Liaison team member for Access. We are currently working on that, so a lot of advising, a lot of improving communication with our tribal stakeholders as well. So help in a variety of ways, both from the individual members, so when there's questions, they reach out to me and I make sure they get in contact with the appropriate department, an individual that can provide assistance to them, same with the tribes. Anytime a tribal leader or a tribal representative gets in contact with me, I am that source of information, and then overall advising Access and the governor's office on anything that relates to attempts to address the situation. Thank you.
Good morning, everyone. My name is Kathy Dill. I am an enrolled member of the Chickasaw Nation. I'm currently serving as the compliance officer for Phoenix Indian Medical Center. In my role there, my role is to ensure that my organization adheres to all regulatory laws, regulations, and policies, and it was while fulfilling these duties that I became aware of the sober living concerns that were raised by our staff and patients. As the incident commander for PIMC's response to the sober living crisis and the displacement of residents from suspended programs, it is my role to make sure that the care and resources available to these displaced individuals are navigated effectively by a dedicated team that serves in that capacity. Thank you.
Good morning, everyone. Yad bene shekia ani adona initially godo bashes chin squidachini edasha chet skabahan edashanella aquat asan initially she shandin perishinishia adot squidanesha de nasha squidanesha do chilchimbit godo denahoto banashado ado she bish badasa uninitially. Again, good morning, everyone. My name is Shandine Parrish, and I am a member of the 25th Navajo Nation Council. I serve on the council representing the communities of Kayenta, Denahoto, and Chilchimbito in the state of Arizona. Denahoto is also partially in Utah as well. So I am very honored to serve in the capacity as a council member of the Navajo Nation, but also working with with all 3 states that the Navajo Nation is within. I'm also the chairwoman of our Budget and Finance Committee, and this morning I just want to thank Mr. Jacob Moore for being gracious and allowing me some time to be on a panel. I know I was slotted for an earlier panel, but I forgot how long the drive was from Kayenta this morning. So thank you all for allowing me some time.
Good morning, everyone. She Mary Descheeny-Reyna Yenashia, Sina Bithling Ainishla, Mindy Gijin Bushichin, Twitchini Deshiche, Hanagachnia Deshnella. Originally from Chinle, which is the central part, which is the heart of the Navajo Nation. Happy to be here. I work here in the Valley. We're working on with the Navajo Nation, working on a satellite office. Which is something that we're looking forward to. But since I am stationed here, I'm also on the organization of Operation Rainbow Bridge, which is the Navajo Nation's response to this whole sober living crisis. I'm excited to share with you the work that we've done and what we've been able to accomplish. Thank you this morning.
So one of the questions we have is, we talked earlier with community organizations, we talked from research to practice to prevention services, and we really want to know a little more about policies. So how can existing policies be strengthened or new policies be implemented to better protect behavioral health services, especially when Indigenous people seeking substance abuse treatment services? So if you can answer that question, and then Mary, if you can answer from Indian Health Service perspective about, how did you first learn about the sober living crisis?
Okay, we'll answer that first. So that particular question wasn't on the list that I had, so I'll do my best to take a shot. But just from the standpoint of the agency, when we first learned about the crisis and how the agency determined it was a systematic crisis rather than isolated events. So early on, the agency received anecdotal reports of irregularities concerning practices and concerning recruitment strategies that were employed by these bad actors. While these early reports did raise concerns, it wasn't until 2022 that we began to witness a more significant pattern of irregularities and anomalies in our billing and service utilization. This marked the point where we started connecting the dots more systematically. Many of these bad actors were effectively exploiting various legal and operational loopholes, making it challenging for us to intervene effectively. So in collaboration with law enforcement partners, we embarked on an extensive review of the emerging reports, and through this investigation unveiled that there was the systematic nature of the issue. We discovered that organized criminal syndicates were at the heart of this particular problem, orchestrating fraudulent activities in the sober living home space. And I say space because many of these wrongdoers were not registered providers, both from AHCCCS and Access standpoint. They found loopholes to get through so that there was no oversight, that they were able to continue with this illegal activity. And so although the initial report surfaced in 2022, it took us some time to fully comprehend the scope of this problem, largely due to the sophisticated tactics that these bad actors employed, because what we're seeing many times is these are criminal syndicates that move from one state to another. They start in one, do what they can, realize, okay, this might work in another state, so let's move on and go do it there. So that's what we're seeing through the research and investigation that we're doing. And then moreover, the most egregious offenders took advantage of regulatory gaps, operating unregistered and fraudulent living homes that were not, as I said, under Access's oversight. The situation severely limited our authority and prompted us to advocate for legislative changes to address these gaps and take comprehensive actions, as multiple tips and reports all pointed to the shared problem. We felt compelled to launch further investigations, and we also employed data mining techniques and established an incident command center in collaboration with 211, Solari 211, to better assist the impacted members.
Okay, thank you. Again, my name is Shondine Parrish, and I'm a member of the 25th Navajo Nation Council. I just wanted to share a little bit about the work that the Navajo Nation is doing with Project Rainbow Bridge. I'll let our fearless director, our leader here, explain a little bit more, but it was the Navajo Nation's take on how to be proactive and wouldn't require legislative changes, but it was a direct response from our administration to make sure that our people were receiving the attention that they needed. But in order for the state of Arizona to support these acts of fraud, the two that come to mind is that we need to improve our ICWA laws, to strengthen our ICWA laws, because our children get affected when their families are being split up. And I speak to this because not only in the state of Arizona and the state of New Mexico have laws that protect children, but in the state of Utah, as if you've been watching the legislature this past year, a major ICWA bill did not pass, and that does affect our Native American children in that state. And this is as our previous panelists mentioned, that these activities transfer from state to state. So ensuring that tribal nations can work together across borders is very important to mitigating this situation. A second opportunity that I know our council is interested in working with state legislators on is increasing fees on these and monitoring non-compliant licenses as well, because we need to be proactive and make sure that we have these ways to stop these attacks before it happens. Through policy, I think that we can be very proactive in creating a legislative plan and direction. I know each of the tribes have their own legislative assistants that work directly with the states, but I know we also have our intertribal council president here too. So I think that collectively, if we can bring this to a collective discussion to support one another at the state, I know that we can continue to support tribal sovereignty and these the challenges that we face. Thank you.
I'm sorry, I was too busy listening. Can you repeat the question?
So actually, there's two sets of questions, unfortunately.
Okay.
So in our first email, we had a list of questions, and our second email, we focused specifically on policy. But the question that was sent out first was, when did your agency first learn about the sober living home crisis?
It was in the first part of May when the state of Arizona notified the Navajo Nation. At that time, we were told that there was an estimated 3,000 to 7,000 individuals that would be impacted, but that ended up not being a case. Fast forward to today, it's found that more than half, at least 3,000, I believe, 3,100 to be exact, are non-natives. So there's something to be said with the monitoring of what's been occurring. And unfortunately, with the Navajo Nation, we're at 889 of our relatives that have been impacted by this. So since May, we've orchestrated and stood up our incident command post, which is a FEMA established incident command post. And we've been operating here in the Phoenix area since then. We provide services to our relatives to either provide them transportation back to our nation or to provide them services and connecting them to adequate services. It was mentioned before that, not knowing who are good services still. And we've been able to facilitate a lot of partnerships, not only with the tribes, but with Kathy here, because PIMC has their ICP, Native Health has their ICP. So as an ICP ourselves, we meet on a regular basis, discuss trends, discuss our numbers, try to find ways to support one another. We've also been coordinating with the tribes of Arizona and the capacity of social services and behavioral health to talk about our trends, to talk about how it is that we can best serve our respective nations in that way. So it continues to be an ongoing growth in what it is that we're trying to do. And I think the earlier panel had mentioned, each of our tribes are different. And that's probably one of the things, and I'm sure it's going to be another question down the way, that we can address is, each of us are different. Each of us deserve to be given the opportunities to serve our tribes in each of our respective ways. Thank you.
Mary, did you want to answer that question?
Yeah. Hi. So I'm going to talk a little bit about our first interactions or first awareness of the sober living issue, and then talk a little bit about what our current and ongoing response has been. So PIMC actually first became aware that there was something unusual going on in regards to sober living back in September of 2022. So we have a team of staff at PIMC known as benefits coordinators, and their primary role and function is to assist individuals who come to PIMC for medical care to also be able to explore enrollment with access and other external resources. We began to get reports from the benefits coordination staff of individuals who weren't coming to seek health care at PIMC, but were only coming for the purpose of either enrolling in access and then switching their plan to the American Indian Health Program. And what they also reported was that a large number of these individuals were not from the Phoenix metropolitan area. Many of them were from out of state. And as was alluded to in the prior panel, many of these individuals were accompanied by others from the respective sober living programs that had brought them there. And then those individuals appeared to be, in some cases, coaching them on vocabulary and appeared to be very, very intent on the beneficiary completing that enrollment process. So since the announcement by the governor's office of the legal actions and the suspensions by Access, PIMC and the Indian Health Service have engaged in what we consider a multi-layered response. So on the 15th of May, we set up our internal incident command structure and developed a plan to assist any individuals who would be displaced from sober living programs that were being suspended by Access and not receiving payment. We believe that PIMC is and always has been a gathering place for American Indian and Alaska Native people in the Phoenix area, and that became even more evident when many of these individuals were from outside of the community and saw PIMC as a place where they could come and seek assistance. So we've collaborated not only with the Phoenix Indian Medical Center, but the Phoenix area, which is of course our area office, the Tucson area office, and the Navajo area. We have an ongoing incident command group that meets regularly where we talk about any changes or impacts to our population as well as the ongoing operations. The staff that are assisting with this are a dedicated team. Many of them have behavioral health experience. They're located on site in a dedicated workspace where they're able to meet with individuals who've come out of some of these sober living programs, working primarily to help them navigate through the 211 Press 7 program, as well as given the fact that PIMC is also a direct healthcare service provider. We also make sure that any individuals who are coming from a sober living program but have urgent or emergent medical needs, that those needs are being met on site as well. We continue to meet regularly with Access and the Missing and Murdered Indigenous Peoples Work Group. We meet regularly, as mentioned already, with incident commands, including Operation Rainbow Bridge for sharing and collaboration and reviewing metrics. Since we've become more aware that some of these bad actors have been operating in states outside of Arizona, we've also worked through IHS to identify points of contact in every area across the country. I've provided direct education to those individuals, giving them some information on some of the patterns we've seen among bad actors, as well as giving them tools that they can use so that if a provider approaches them, they can do some navigation on their own and find out whether the provider is suspended, look at any potential licensure actions, et cetera. And then more importantly, we've been educating our staff and our stakeholders. Even going back to, say, October of last year, that was the first sharing we did with staff. We've done some teachings during our town hall meetings and our leadership meetings at PIMC, helping them understand some of the behaviors that they may observe among some of these bad actors. We also provided training that was generated by the Department of Homeland Security. There's the Blue Campaign, which is a program specifically targeted to teaching about some of the observations you might see in human trafficking, as that was some of the concerns that our staff had brought forward, was that some of the behaviors and the interactions between the bad actors and some of the individuals they were bringing in for care, that it appeared to have some sort of element of trafficking type behavior. And then finally, we also have taught our staff how to navigate the reporting processes that are available to them, whether it's reporting directly to Access Fraud, reporting to the FBI through the Sharing Victims program, using the HHS OIG portal as well to report any concerns they have about bad actors, and of course making them aware that within the state and within local communities that law enforcement action may be necessary, particularly when the individual that's relaying a story of being in a potentially fraudulent program is someone who fits the definition of a vulnerable individual. So that's really what our response has looked like, and we continue to actively engage in all of those activities. Thank you.
Thank you so much. So the next question I think on your list is what is the one thing you would like the audience to know about the sober living home crisis? Is that the next question you have on yours, Christine? You don't have that one on your list?
And it's about the agency response.
Okay, so what's your agency's response?
So in response to the situation, the state immediately established an internal dedicated task force in collaboration with the Attorney General and the Governor's Office, and an external incident command center in partnership with the LARI and other providers, local, tribal, and law enforcement partners to address the crisis We initiated a thorough internal investigation to identify the extent of the issue and implemented administrative solutions to remove the bad actors from the system, from our programs, and to ensure payment to these facilities halted. We also enhanced our monitoring systems, updated policies and procedures, and increased oversight and audits to prevent further exploitation. We also immediately began collaborating with state departments and tribes and other tribal stakeholders like the IHS and Navajo Nation's Rainbow Bridge and others, so we could immediately work with also law enforcement as well, to make sure we coordinated resources and care for impacted members. The agency continues to look through do data analysis and communicate with the affected parties, and we're committed to transparency. So we have regular meetings as well, weekly check-ins with our tribal partners. They all have invitations to these. We're also making sure that we improve our tribal consultation process. I was fresh to this position when this came to light, and so it was as soon as I hit the ground, I started running, and one of the big blaring situations that I saw was that the need to improve tribal consultation. Because things like this could be prevented if we're working in collaboration with our tribes in the true sense of consultation, sitting at the table with them, bringing potential decisions to and issues that we're encountering to the table and talk through solutions that work for both sides. And so in that, we've been actively making improvements to our tribal consultation, everything from improving the dialogue, because before it was a lot of presenting at the tribes, not consulting with them, not dialoguing with them and problem solving with them. And so we moved away from that previous format and now make space to ensure that tribal leadership have an open hour at the very minimum on our reoccurring tribal consultation agendas to ensure that they can share issues that are coming up that we may not be aware of just yet. And as well as using Dear Tribal Leader letters, which we haven't done in the past. And also, we're excited to explore the possibility of working with Maria Dadgard and the Intertribal Council to also build consensus and understanding with tribes before we push through anything and make any decisions. There's more policy things that we've implemented. I'm sure many of you are aware that we've suspended more than 300 providers at this point, and it was a multi-agency effort. So we could ensure that individuals who weren't bad actors weren't caught up in the suspension. So just wanted to share on that end. Of the 300 providers, of those who have officially appealed to date, only a handful have been successful, which says a great deal about the multi-agency effort to ensure that the processes to end up on the suspension list, they weren't knee-jerk. They were really thorough and thought through so that we, limited the impact that it would have on those individuals and those providers and the members that have been impacted by the situation. Other efforts that we've made is we've elevated 3 behavioral health provider types to high-risk categories, and now we're requiring fingerprints and on-site visits, background checks, and additional disclosures so that upfront when their providers are registering, we have as much information about them, where they're at, who they're treating, what they're doing, and we're going to continue to make these type of systematic changes so that something like this does not occur again.
Thank you. So Mary, did you want to address that one as well, or did you want to pass on to Shandine?
Me too. I think on this side of the panel, we have the same questions. So I think the questions that I have is number 2, what role can community organizations play in collaborating with policy leaders to address the issue effectively? So, the Operation Rainbow Bridge has been collaborating with many of the metropolitan community organizations here. The Navajo Nation is a little, in population size, we're over 400,000 people. So 400,000 people that live on the reservation on the Navajo Nation in 3 different states, but also a great portion of our enrolled members live off of the reservation, not just here in the Phoenix metropolitan area, but across the United States. And but specifically speaking to the local issues here in Arizona, when we as the Navajo Nation collaborate with community organizations, we do have our satellite staff, just like our Operation Rainbow Bridge, who directly collaborate on behalf of the Navajo Nation, the Division of Social Services and the Division of Behavioral Health. They work with the local community to address and make sure those services are communicated as quickly as possible. Even our Navajo Nation police have become a part of the effort, and that's a discussion of jurisdiction and so on and so forth. So it's a very intricate discussion through the Navajo Nation that we've been able to assist as many of our tribal members as possible. But when it comes to addressing the issue on Navajo and our border town communities, there are organizations within the border towns that do assist with that communication with the Division of Social Services. But in regards to collaborating with policy leaders, I myself, as a member of the 25th Navajo Nation Council, within our government, I'm a policymaker. So we have a 3-branch government where the council are the legislators, and ensuring that community organizations can provide accurate information through white sheets or white papers or small, just 15-minute to 30-minute conversations are crucial to making sure that accurate information get to policy leaders. I used to work at the Arizona State Senate, and when I was working with our senators, their legislative process required lobbyists and required certification of information to ensure that that information was given to the Arizona lawmakers. And I don't see that any different as working with tribal leaders across the state of Arizona and also across the United States. This is a nationwide epidemic, and this is a very important time to continue the conversation with each and every one of the tribes. I know we're talking about local issues, and I too am an alum of Arizona State University, so I'm glad that we're having this conversation here because it's very direct. It is still current. I graduated with my master's degree in 2022 and then my bachelor's degree in 2028, and I'm still involved in the Arizona legislature, and then I used to work for the treasurer's office. So that conversation is ongoing for the career that I've had so far. So I just want to encourage each of the community members and organizations to continue that conversation, that it is important to strengthen those relationships. Thank you.
I'll take the question of what I want you to know about sober living homes. I think what resonates with me the most as we've been in this operation for this duration of time is that we continue to have deaths that occur in these homes. I've not seen anything being done to our relatives who have passed away in these homes, and I'm glad the first panel had addressed this and made it personal to losing direct relatives. Nobody knows what that's like unless those of you who have your homeland and are Native American, knowing that people from your community are coming home cremated, not knowing how they passed, not knowing, and we still have relatives on our reservations not knowing if their relatives have passed because they're still missing. I don't think, and this is my personal opinion, I don't think this matter is going to be put to rest until we have a really good hold with what's going on with these homes, because as soon as one shuts down, another one will open up. The inspections, there's over 500 inspections that have been done by the state of Arizona, but as soon as one closes, another one will happen. Or the inspections will occur, they'll knock on the doors, nobody will answer that door. So they go back again, still no one will answer that door. So something is missing that's not holding these bad actors accountable. And as was stated with panel 1, they need to listen to the tribes. These are our people. These deaths need to stop. Our people cannot be missing any longer, and we need to be heard. Thank you.
So again, with Christine and with Mary answering the question, what are the one thing that you would like the audience to know about the sober living home crisis?
To piggyback what off Mary just said is identifying these bad actors is very much like a game of whack-a-mole. As one problematic business gets shut down, another one seems to pop up in its place. It's a continuous challenge that requires the collective vigilance of the entire community to protect our members. Some of the red flags to look out for include providers who exclusively target American Indian Health Program members, those who coach non-tribal members into joining AIHP, providers offering incentives or kickbacks for using their services, and those seeking direct contracts with tribes for payment. So that's the next step we're seeing, is if they are suspended providers, they're trying to jump directly to the tribes and ask for contracts with the tribes so that they can continue receiving payment without having to go through a state agency to do so. And then the other thing is, being this a university center, universities offer a wealth of expertise that can benefit our agency and tribal communities. They can conduct in-depth research on substance abuse landscape, identifying trends, risk factors, and best practices for prevention and recovery. Academic institutions can also provide educational resources for training our staff, developing more effective policies, and disseminating information to tribal members. Additionally, they can assist in developing community-based participatory research to create targeted interventions addressing the unique needs of tribal members. And tying that back to the tribal leader panel, where traditional health was brought up, and how do we help our community members using traditional health. And I'm excited to share that we are hoping, Access is hoping to be the first in the nation to get approval for traditional healing. And that's something we're very much pushing as a piece of the solution to this issue, because our ways work. We have proven that since time immemorial that our traditional ways work. And even in the current setting, we have evidence that suggests the same. The issue is, like we all know, trying to fit a square peg into a circle hole is a lot of this, the state and Western medicine relies on evidence-based solutions. And traditional healing doesn't fall in that realm right now, even though we have that information that says it does work. And so researchers, academic institutions, and if we can find more ways to, we shouldn't have to do this, but that's the system we kind of work in, is doing research on traditional healing that proves that end goal and fits the evidence base. How we can do that, I don't know. But that's one thing that we're seeing is in the things that we're doing is pushing for traditional healing and hoping that we can bring, in our own way, recovery to our tribal populations for a serious issue that has been long going.
All right. So I guess I have a couple things that I would like to share with you that I think would be important for you to know based on what we've learned through this crisis. And the first thing is that when we heard that Access was going to be suspending programs and payments to them, our first reaction was that these were going to be individuals who were going to be in need of reputable treatment. And what we found was that it really just highlighted the ongoing crisis we have in our state and in our community of the plight of the unsheltered, that many of these were individuals who didn't have any place to stay locally and may have actually been homeless in their home communities as well. And it really did highlight the need for urgent short-term and long-term shelter resources within our community. The other thing that we've learned really is that knowledge really is power. So as we've shared within our own workforce, for example, at PIMC, many of whom are Native themselves and also seek care within our organization, and as they've shared what they've learned about how these bad actors operate and some of the dangers of it, how that's been shared, well, we've heard some really gratifying stories. So as we have individuals coming to our staff for assistance after leaving shelter or sober living homes, we're seeing more and more reports of individuals who've decided to leave voluntarily because once they were in the home, they recognized that what was being offered to them wasn't what they were looking for, that there were concerns there were red flags within the home, and they've left voluntarily. The other thing I'll share with you too is that we've had anecdotal reports where we've had members of our community who have observed some of these bad actors trolling for clients in public spaces, et cetera, and they've observed individuals flatly turning them down and saying, no, I have concerns about you, I don't believe you're doing this the right way, and they've walked away and they've kept themselves safe from that environment. So I think the more that we can make our populations aware that there are bad actors out there, that there are red flags that one can use to identify them, and also, which can be somewhat challenging sometimes, but too, trying to help them point in the direction of reputable programs for those who do want sober living, as well as residential treatment. And in the Indian Health Service, we work really closely with tribal and urban partners that we have established relationships with that have documented that they provide reputable treatment that does follow the continuum, you know, as was mentioned in our last panel, of not transitioning someone to sober living until they've actually gone through an addiction program and have established a path to sobriety. So really being able to help folks understand how to identify those reputable programs and connect with them is also another lesson learned that I would share with this group today. Thank you.
Thank you. Shondine, would you like to answer that question or the question on the list?
I'll do the list, but I don't know which question we're on now.
So we're on question 3.
Okay, number 3. What initiatives are currently being worked on to support tribal partnerships? How can organizations begin working with tribal or urban Indian programs? I think the last panel did a great job at sharing the resources, especially the Phoenix Indian Center. Our CEO shared a lot about how the Phoenix Indian Center itself has become a hub for all tribal nations across the United States to make sure that they and it does take great leadership, because the Phoenix Indian Center itself, it is a organization for resources, but when you're working with you know, health sensitive information, that is a different type of training. And so I really commend our urban Indian Center here and just all of the centers in our area who have taken on that initiative, because it does require a certain sense of sensitivity and just awareness of and just ability to do that sort of work. In regards to how the Navajo Nation is continuously has made an effort to work directly with the community here in the Valley. The Operation Rainbow Bridge, we do have a staff member that lives in the Valley that coordinates that, and I'll give her, you know, time to talk about her work here and what that looks like, because, you know, I drove today 5 hours from Kayenta, Arizona, and for the individuals who don't know how large our state is, I live on the Utah border, the Utah and Arizona border, and the Navajo Nation, a lot of our affected tribal members come from different states, and it's an interstate discussion at that point. But making sure that those lines of communication is very important between tribal nations and then non-tribal entities to continue that work.
I have so much more I want to share with you, what you need to know. I call this our unfortunate reality section. When I give our presentation about Operation Rainbow Bridge, I think what needs to be known is that a lot of people either came by choice, they were lured, as we know, but they came possibly with an addiction already. They're leaving these facilities, if they're lucky enough to leave, if you want to say it that way, with other addictions as well. So they're brought to the city, they have new addictions. Everything is more accessible here. So what we're finding is a lot of our relatives don't want to go back to the nations because there's not much in terms of satisfying those addictions, but also what we're finding, unfortunately, is that there's not much there in terms of housing. We're challenged with that. There's not much there in terms of facilities for further treatment on our nations. So we're finding that as well. I spoke a bit ago to the deaths that are occurring. Of course, with that, know that families are in these facilities, children, and that goes to Delegate Parrish's earlier comment about ICWA. it's a sad, unfortunate reality, of course, that not only are deaths occurring in these facilities, but various types of violence. And let you think where that may go, because the worst we have seen and we all know are occurring in these facilities. This morning, Operation Rainbow Bridge has been in operation as long as it has been. This morning, I got a email from a local tribe asking us to spread information about 2 of their relatives who came down to go to the state fair with the SMI group. Now 2 of those relatives are missing. That's that population as well who are involved. Individuals who are on their medication, who have unmet medical needs are a part of this scheme. Lastly, the recruitment efforts. Unfortunately, we're finding as well that our own tribal members are a part of the recruitment efforts. Of course, being enticed by being paid, enticed by gifts, and enticed by food. Those basic things are what are occurring, and that's what our nations are dealing with. Thank you.
So much. So we have one final question. So what can we do as a community to prevent a future sober living home crisis? And so we'll go from that way, heading north. So you can start.
Going back to a lot of the things that have been recommended today is really that knowledge, informing individuals, staying in the know, especially our family members and relatives that need to be in these sober living homes or rehabilitation facilities. A lot of the time they're so focused on getting well and getting better that it doesn't come to mind. I need to ask, what facility are you associated with? Where are you going? Asking something as simple as that of your family and friends, of where are they going? Who are they going with? And there's a list of resources on the Access website, because one of the things we continually heard is they would take them in a state that they were unable to, they weren't complicit. A lot of the times they were inebriated. They couldn't make sound decisions. They just came to sober up and were in Phoenix or some other facility. And so that's one of the things that we have is just education. And even if there's recommendations for us about what we need to do to get in contact and market or communicate with community members to inform them, empower them with information. The other piece is reporting. As someone from a reservation, a tribal community where these things were happening long before they came to the state and national attention, we saw those vans on our tribal lands. We heard of people disappearing. We've heard of, we heard a lot of that stuff, but the disconnect was that reports were not happening. We were reporting it to each other in our community, but there was a lack of reaching out to the state agencies, to the federal agencies, to say, hey, something's not right. And unfortunately, that's one of the pieces that we really do need, is for the families and those impacted to submit those reports, because without those type of reports, we don't have the evidence that we need in order to bring these wrongdoers to justice and make sure that we address the systematic issues that are occurring and making this type of situation possible. And then, as Mary pointed out, the other piece is to our tribal leaders and other communities a call to help, because what we're seeing in these is it's not, most often is what we're seeing when individuals are contacting Solari asking for help, it's not an issue of them needing a facility to go to. It's they need a place to live. It's a housing issue more than anything at this point. They are choosing to stay in these facilities because they're provided housing, because they're provided food, they're provided their basic needs, whereas if they go elsewhere, if they go back home, they don't have those same things. And in its own way, those are the type of things that they need in place to stay sober, to make their lives better. And so they're kind of in this weird in between, because again, when they contact us and we call, over half of them that are specifically American Indian and Alaska Natives, it's not a question of going to a sober living home or a rehab facility. Again, it's just they need a place to stay. They need a roof over their heads. So if the community can help, with pushing some agendas in terms of housing, because that's not really in Access's field. We're trying to make those connections, but we can only do so much on our end. We can do a lot on the health and try to fix, help ADHS with the sober living thing. But outside of that, providing stable housing for these individuals and resources to live, that's one piece. And then the reporting and education. Those are the three areas I believe that the community at large can assist with to ensure something like this, help ensure rather, that something like this doesn't happen again.
Yeah, and I would echo exactly what Christine just said too, that really the public awareness, the education, the understanding of behaviors among bad actors that wouldn't be consistent with reputable providers. I've used the analogy and descriptions before that I can't remember the last time that the fire department came and knocked on my door and asked me if I had a fire that needed to be taken care of. And the fact that many of these bad actors are in such an active recruiting phase and they're connecting with people in public areas, in parks, in different communities is a big red flag, and helping people to understand that that's not the way typical healthcare is delivered, and that's not the typical interaction you would have from a reputable healthcare provider. That's a big piece of it. And again, just continuing to develop resources for those that are unsheltered and helping them to connect with existing resources that they may have access to. I know in some of the work we've done as our incident command, we've had some interactions, for example, with an initiative from the Biden administration that's called the All Inside program, and that's targeted efforts to work in specific communities to try to improve shelter capacity. So we've met with them. I know there's also some resources available for Native veterans through the Veterans Administration. So again, just really trying to help individuals identify where they may be able to seek resources within the community when they're unsheltered. So that's been a piece of our work and something that we're continuing to message to our stakeholders.
I'm going to put my W.P. Carey School of Business Knowledge to use. So I have my bachelor's degree in political science, and I spent a lot of time working in government, but I decided to go back to business school because there's still a part of governmental services. This particular issue is a healthcare provider. It's an industry that people are making money through this process, and to increase the barrier of entry is one legislative way that I know we can make a direct impact in making it more difficult for these bad actors to enter into this industry. And by increasing that through legislative changes, by implementing fines, monitoring fines, assessing fines for everything, really, because if you are serious about if you're just in it for the money, then that's a huge deterrent for this being a nuisance and just killing so many people. So if you're not truly divisive or really have the proper network to be integrated into the healthcare services industry, I think that's a one legislative way that I think that the state of Arizona, the state of Utah, the state of New Mexico, or any state really can take a direct approach to making a change. I know education is a huge part of it, but I think that's us as a community, us as tribal leaders, us as tribal members, to take that approach to make sure that we pray for one another, that we're speaking up for one another, but on the heavy lift side, to ensure that there is a challenging way for bad actors to get in there. I mean, we have to be creative in the way that we reach these solutions. Thank you.
I think, excuse me, continuing to spread awareness. We've done pretty well within the state of Arizona. Everyone that's been on the panel has had a huge impact in spreading this throughout the state of Arizona to the point of bringing it to this forefront here. But continuing to spread awareness nationwide to further protect, as mentioned in another panel, our tribal nations across the United States to ensure that this doesn't replicate anywhere else, to continue to advocate, to hold the state accountable, communicating and collaborating among ourselves as tribal nations is really important, because it's important we share these trends. If we had known about this earlier, maybe we could have addressed things a lot sooner. It couldn't have gotten to the degree that it has now, but we're doing it now. And I think, if anything, we've proven that we have strength in numbers when we unite. We need to continue to have that advocacy of our voices as tribal nations to make sure these changes happen, and to hold those accountable that need to be held accountable. Thank you.
Thank you very much for the panel for providing really wonderful information and perspectives on this crisis. So let's give them a round of applause. And I hope all of you have taken notes and really thought about the question, thought of some questions, or maybe some things that are just sticking in the back of your mind, because we really want you to really talk about that in the listening sessions in the afternoon. There'll be 3 listening sessions from University Tribal Consultation for Research. There'll be a community listening session and a practitioner listening session, sorry. And I want you really to think about the questions you have right now, what you've heard over the 3 panels that we've had from tribal leaders, from community members, from those who have organizations and programs, and then from those who work in our state offices. Really have conversation. Ask those questions. Have discussion among your peers here. There's peers that you can collaborate with in terms of developing research projects, strengthening programs. We have students here who may be going into the field, offering them support, encouragement. As we heard, we need more researchers, we need more practitioners, mental health practitioners. There's various programs out there. So really think about that, because with this gathering here, we just don't want you to listen. We want you to also act and also be part of the solution, because it takes all of us to really address the situation. All of us have been impacted one way or another by the sober living crisis. It's a new form of victimization. We had the murdering and missing Indigenous peoples. We've had relocation. We've had boarding schools. We've had cycles of trauma, but we've overcome that, and this is because we had advocates and we've had community. We need to be able to bring this issue out into the open. It should not be silence, because silence is our biggest enemy. It should not be an issue where it's just one family or the community doesn't talk about it. We really need to talk about it, as was stated earlier in the GONA model, where a gathering of Native Americans, you address the issue, you talk about it, you grieve, you discuss, you get all the emotions out, and then you act on it. So that's our next steps, and I really want to thank you for participating today.
So thank you, Agala, this morning again for being here, but also we see you as some of the greatest resources in terms of thinking about, what does this all mean? And again, I just wanted to reiterate, those that weren't here when we started this morning, I was sharing with them that I'm old school because I had taken an article out of last week's paper, so this is the original cut and paste. That's not a cut and staple in this case, but really just to kind of reiterate how this is happening now. And also, again, just the really the level of the travesty in terms of what does this mean, and what is the role of universities in terms of how we address these issues within our community. I think to add insult to injury, going back to the story, it was really new charges on this in Access fraud case, and the subtitle of the article is $1.5 million home and 8 cars seized from the suspect. I'm not going to name the suspect, but it says that a healthcare provider, 2 owners and its biller were indicted and accused of fraudulent billing of Arizona State Medicare Agency. It goes on to say that the provider, that the state indicted the company on October 2nd, and a news release stated that there were 2 of them were employees and the other was the facility's biller. It said government records revealed, according to the release, that the healthcare facility billed Access and the American Indian Health Program for more than $115 million in behavioral health services between December 21st, or 2021 and February 2023. According to the recorded documents in Maricopa County, one of the individuals received an asset forfeiture notice in July, and to basically hand over $8.2 million in property to the Attorney General's office related to these criminal charges, which included a 4-bedroom house that was purchased for $1.5 million in cash in January, and that was seized along with 8 cars registered, including a Corvette, 2 Bentleys, and a Porsche. So these unnamed defendants are facing 19 felony charges, including conspiracy, illegal control of an enterprise, fraudulent schemes and artifices, and multiple charges of theft. But this is just one. And again, the article also talked about other agencies who had similar charges, but also were not prosecuted or not being indicted. So this is a significant issue within our communities, and I think important for us to really understand, not only from a community level, but from an institution that is here to serve our communities in terms of what does this mean, from a research perspective, or how do we do applied research within our own communities. I'm not going to belabor in terms of the opportunity for you to have this discussion amongst yourselves.